being recorded.
Welcome, everyone. Thanks for joining us today on this webinar. I'm Emily Smith-Gehring, and I'm here with my colleague Edna Davis-Brown, and we're implementation specialists at the Center for Adoption Support and Education here in Burtonsville, Maryland, outside of Washington, D.C. And today we also have a special guest. We're joined by Michael Stankowski from Youth Villages, and he's here to talk about his agency's experience with implementing NTI. So we're really here today to share more information about the National Adoption Competency Mental Health Training Initiative and give you a view from a pilot site on their experience with the training. Again, as Tiara said, if you have any questions throughout the webinar, please enter them into the chat box. We'd be happy to answer them. So we're gearing up in today's webinar. This is the second in a series of 5 webinars that provide strategies and tools to assist in the integration of NTI into your agency system, state, tribe, or territory. So we're excited to be here today to talk about implementation and application, preparing to launch. We'll focus today on getting you started. And in this webinar, we're going to be covering an overview of NTI. We'll be sharing from the NTI pilot site from Youth Villages. Talk about some of the tools for how to successfully implement, how to access NTI, and then some optional services and support success. And again, have time for question and answer. But most of today will really be having Michael talk about their experience and how it really worked within the agency context. We'd like to, of course, thank all of our strategic partners, organizations that were really integral in the development and production of NTI. That includes the Dave Thomas Foundation, Red Adoption Program, NICWA, PolicyWorks, and of course the Children's Bureau, from whom we received a $5 million collaborative agreement to create and develop this training initiative. And of course, we'd also like to thank our 21 national advisors that include adoption researchers and scholars, child welfare administrators, mental health professionals, and individuals who have lived experience as foster and adoptive parents, adoptees, and formal youth. We all work together to complete a literature review of national training programs and identify these core competencies, the knowledge, values, and skills that really are needed for adoption, mental health, competent child welfare practice. And so our NTI core competencies can be found on our website, and we'll post that link. It's adoptionsupport.org/NTI. We have a lot more information about the competencies, and we'll be talking briefly about those. So I'm going to turn it over to Edna now to talk a little bit about why we created NTI and what that means.
Great, thanks, Emily. We also use information gleaned from those who have lived adoption every day, those with actual lived experiences. Adoptive parents report that competent mental health services are one of their greatest unmet needs, too frequently reporting practices that are ineffective or even harmful to their families. Let's talk a bit about the mental health profile of children in foster care. The American Academy of Pediatrics estimate 30% of children in foster care have severe emotional, behavioral, and developmental problems. And 40% of youth from foster care are diagnosed with ADD, ADHD, with a high incidence of prenatal drug and alcohol exposure. A few guiding principles here. With more than 135,000 adoptions each year in the United States, NTI is guided by principles listed here. Adoption has a lifelong impact. Grief and loss are at the heart of adoption, guardianship. Children should not have to change excessively to fit into a family. Secure attachments can be built or rebuilt. Identity formation is more complex in adoption and guardianship. And of course, race, ethnicity, culture, class and gender identity, or sexual orientation all have a unique role in adoption and guardianship practice. Through NTI web-based trainings, CASE will support a common core of mental health and adoption learning that will enhance the ability of child welfare and mental health professionals to really speak a shared language and to collaborate to better serve adopted children and their forever families. Now, I have a question of you. Here we have a poll. I'd like for you to respond to this question around the benefits of web-based training. Tiara, you want to give some instructions here?
Oh, you can respond in the chat box. So if folks haven't opened up the chat box, please use your mouse and scroll to the very bottom of your screen and open up the chat box towards your right-hand side. And please go ahead and respond to the poll right in the chat.
So we'll give you a few seconds to respond to this question about the benefits of web-based training.
Great, we're getting some good responses.
Yes, we
here.
are. Wonderful. So several responses I see on the screen are around being standardized, accessible 24/7, provides the ability to do the training at one schedule and pace, not trainer dependent, can be done at office or home or any location. And one of the things we focus on too is cost effective. So great responses, and certainly the benefits of NTI as a web-based training. Thank you for participating in the poll. So next slide. Essentially, with NTI, the focus is building competencies and skills to enhance permanency and well-being. Here we'd like to show you the two curricula. We have, of course, the child welfare curriculum and the mental health curriculum. The curricula are identical, however, they are aligned, or they aren't identical, but they are aligned and complementary. And here you'll see that they're for child welfare, 20 hours, essentially CEUs, and then we have a supervisor's module at the end of the child welfare curriculum, or part of the child welfare curriculum. And the supervisors really focus on lessons that are down with a downloadable coaching guide, and it really helps with application of learning and practice. The mental health has 10 interactive learning modules, and it really includes new assessment and treatment strategies through an adoptive lens, and focuses on 12 evidence-based treatment interventions. Again, both trainings, or all three trainings, are approved by NASW for continuing education credits. Let's talk a little bit about the key competencies here. As mentioned previously, the curricula are not identical, but they are indeed aligned. You'll see some of the topics listed here, focusing on children's mental health challenges, loss and grief, impact of race, culture, and diversity, etc. And then the two competencies at the bottom in yellow are really contained within the mental health curriculum: assessment and treatment planning, and therapeutic parenting strategies. Now that you know about NTI, let's hear from one of our pilot sites who was an early adopter of NTI and has continued to use it with its staff. Michael?
Thank you, Edna. It's a real pleasure to meet everybody today. My name is Mike Stankowski. I work with Eulogist, and I'm the Clinical Services Manager for our Treatment Foster Care Program in Tennessee. If you want to go to the next slide there, please. I'm going to tell you a little bit about Youth Villages. Youth Villages is a national nonprofit. We actually serve about 26,000 youth and their families each year in 17 states. We're primarily an intensive in-home services nonprofit agency with residential treatment programs in several states, but we also have a transitional age YB Life Set program for youth who age out of foster care. We also have a small program of adoption services specifically in Tennessee. So we serve about 700 foster children a year in Tennessee, of which about 70 to 90 of those will assist with moving to permanency through adoption. Youth Villages is a very strong private-public partnership with the other providers in the state of Tennessee. And if you want to go to the next slide there, Edna. Thank you. So Tennessee was selected as one of the initial pilot sites for the NTIA pilot. And because of the strong public-private partnership in Tennessee, the Tennessee Department of Children's Services asked that providers partner with them in this training. This was a great opportunity where we actually ended up having over 1,000 child welfare professionals go through the NTI curriculum at the same time. And the why behind that is that we wanted to have that common language as we come together for child and family team meetings to work on safety, permanency, and well-being for children. We know that kids who are served in treatment foster care have frequently experienced multiple out-of-home placements, which have impacted, their placement stability. Their movement towards permanency can be clouded by termination of parental rights, and that these kids who are fostered to adopt, they have special needs and vulnerabilities beyond what we expect for all kids who are in foster care. So at Youth Villages, we were absolutely like, yes, we would like to partner with this initiative to do the NTI child welfare training in the state of Tennessee. And we spoke with our senior leadership, and we actually chose to send all of our foster care counselors and their supervisors through this child welfare curriculum because if we were going to do it, we wanted to be involved and make sure that we did it the right way. So I personally have some experience with the training for adoption competency. I went through the 72-hour year-long training for that, and I know how expensive that can be in terms of travel, time away from the job. How do you bring that back and transfer that to a team? So then when we heard about the NTI child welfare curriculum, we're like, man, this is a really awesome opportunity for us to get excellent training for our staff in a way that's cost effective and for all those reasons that we identified in the chat, that it can be done at their own pace. There's resources there that help with the common language. And so we absolutely signed on for that. If you would you go ahead and go to the next slide, please, Edna? Thank you for that. Oh, actually, back up one more. I got a little bit ahead of you there. Thanks. So when we think about scope here in Tennessee, we initially started in September 2016. I mentioned the leadership were kind of aligned with sending the foster care counselors through 112 staff. And one of the things that's really beneficial about the child welfare version are those supervisor modules. And so we wanted to make sure that the supervisors had that opportunity to reinforce those key concepts at group meetings and during any team meeting that they had. How do they support the learning that's kind of going on there? We do have our own internal tracking instructional design system. It's called YB Learning Center. And so we built out the curriculum in that where we would have staff kind of enter there and then go to the portal at University of Maryland, complete, come back and check off that they had completed that. And that was data that we used to kind of cross-reference in all of our reports that we shared with the state. So when we went to implementation meetings, we could share with them, this is the number of staff we have participating, this is the progress that they're making, and we were able to crosswalk that with the University of Maryland's data. Now, as you all think about implementing NTI, you guys are not going to get the pilot version, but I'm sharing some of that background information because it's really helpful in terms of lessons learned. As we did our tracking on how our staff completed, we learned some pretty interesting things. I'm going to share a little bit more of that with you here today. One thing in particular I want to highlight again with that supervisor module is that modules, that handbook comes to support those modules. It's really specific in terms of this handout goes with this lesson and how do we apply that. And near the end of my time with you, I'll start talking about how my staff felt that this was valuable to them and how did it add value. And one of the ways that it did that is they would do the training and they would literally have that opportunity to kind of walk out and apply that right away with kids and families that we were working with. So supervisors being able to work with our frontline staff, child welfare professionals, to support that, that was a really beneficial piece for us. All right, and then would you go ahead and advance to the next one? Thank you. So this has got a little bit of information about what it looked like for our 61 counselors, 37 supervisors, originally 112 enrolled, 98 dropped off. You guys know if you work in our field, we sometimes have some turnover and things like that. And we thought it was important to kind of track these numbers. As we talked with the state about being a partner in this, there was a decision that had to be made about, is this a voluntary training or is it mandatory? I mean, obviously 20 to 25 hours of training in addition to all the other on-the-job training that we do. We did make the decision to make it mandatory for these staff, but even then we saw an 80% completion rate with 78% of the supervisors completed. So of those 20% who did not complete, there were some that expressed some concerns about the duration of the training, and some individuals did struggle with the online format. Now, this is a high-quality training. You click by click, watch the video, see the resource, but even then, you know, some learners struggle with that interaction, and so we had to make some adjustments on how we worked our staff through the NTI curriculum. I'll share a little bit more about that in a moment. What we labeled that as is maybe a little bit of discouragement for those staff that, oh my gosh, I got to sit down and do this on my lunch break, or do I have to do this in the evening? When we had started to identify that some teams or an individual staff was starting to lag behind, we did try to integrate it into their typical business day, where could several of the team members get together for quote unquote like lunch and learns, you know, so that they would come together, watch a module together, and each of our staff had their own individual computers for tracking purposes and all that stuff. But they could log in and log out together and spend some time about it. Because if you get a good transfer of learning, people are experiencing the learning and it's ringing some bells for them and they connect to it. And there's that connection, we want that to be at the individual, but also at the team level. Like, oh, you know what? I could really go apply this with this young person or this family. As we noticed that some staff got behind, they might try to catch up on after hours or on weekends. One specific accommodation we did for that was to encourage them to block out 2 hours per week for this. They didn't have to do 2 full hours of training each week, but we wanted them to block out 2 hours so that if crisis came up, situation with the family or something, they could at least, you know, hopefully get an hour in a week so that they had a good gradual pace through it. What we wanted to avoid was a staff member sitting down and doing the whole curriculum in a week or two. We just didn't feel like that was digestible and that would be helpful for their transfer of learning. Our senior leaders were also involved in tracking this progress through that reporting system that I mentioned, and it was helpful that our leaders were invested in seeing our staff successfully work through this to have an impact on the kids and families that we work with. All right, I think that's about it for that one, Edna. We'll go to the next one. Thank you. So this slide kind of sums up some of our key outcomes and our lessons learned. We did find, obviously, with initiatives like this, you're going to have some champions, and those early completers, we want them talking about what they liked, what they loved, what they learned as they progress through this. And obviously that has an impact on those team dynamics. So if a new staff member was maybe struggling with understanding a concept from one of the modules, those champions can kind of be a senior counselor or support to them in that process. We did notice that our more seasoned, experienced, tenured staff, those staff who'd been with us for a while, they'd already completed their basic training. They had already had some exposure with kids and families working on well-being and permanency and safety. They digested this content a lot better and were able to apply it more swiftly. So as you think about rolling out and integrating with what you do at your agency, identify those champions who are passionate to get done early, but they've also got some experience and they've been trained. So how are they going to integrate this into what they do? New hires obviously struggled. So in that first 6 months of hire, do you apply the curriculum at that time? For our pilot, yes, we had everybody who was coming in. We just rolled them right into the pilot and caught them up. And those were some of our staff who struggled with that, getting caught up with all the other additional trainings that we have them do in that first 6 months. One thing that our implementation team really shared with us was the value of getting our staff members through Module 5, getting through that halfway point. There was some research that was shared that staff are much more likely to complete once they get to Module 5. Initially, I was a little skeptical, but yeah, I mean, it actually played out that way. We saw our staff who could get to that Module 5 were much more likely to finish the entire curriculum. So that's very beneficial. That's about it. Some of this data that I'm sharing with you did come from our staff surveys at the end of the pilot phase that we worked on. All right, Edna, if you'll go to the next one, thank you. You're there, 93%. Go ahead and stay on that one for just a second. All right, so 93% of our staff reported this material was valuable in their day-to-day work. I mentioned how that was applied, and this helped to reinforce their completion, that this wasn't just training that you completed to get on your record or to get a continuing education credit. I mean, this was stuff that they could use, and it made an impact. I remember one specialist in particular sharing with me on the diversity module. They had some youth in there talking about family acceptance and rejection, and some of the videos in the NTIA in particular. They're like, can we show this video to one of the kids and foster parents that we're working with? We're like, yeah, there's no problems with that. And so that really helped reinforce completion, that as they were going through the modules, this was really good content for them to use. So it was immediately accessible for them to use. And as Edna and Emily pointed out at the beginning, it's helpful to have common language and concepts. I mean, this is in our field, and you think about like the Columbia Suicide Severity Rating Scale, that's an assessment that assesses for suicide. One of the key benefits of that is commonality of language. Well, the NTIA Child Welfare Professional Curriculum standardizes some of that language. So as our staff go to meet with kids and families and then come back to talk to other professionals, it's very beneficial to sit across the table from another professional in that child and family team meeting, and we're talking about the same thing in terms of language. Is that attachment? Is that grief and loss? Is that separation? Is there a cultural or diversity issue here that maybe we're not considering? So those common language and concepts, that's a core element of adoption competency, and we felt like that was really beneficial for us in terms of benefits. One thing that was interesting, this is after the fact, 69% of our staff, after they completed this quote unquote, we made them do it, mandatory training, they felt like, you know what, this really should be mandatory training. And for me, as a manager, I felt like that was really indicative that this was a high quality training that's applicable to what they do. All right, Edna, let's go to the next one. This is one of our surveys that we did with our staff, and we asked them some pretty straightforward questions. Of the training that you just went through, what did you find to be most beneficial, most helpful? Maybe what wasn't so helpful for you in your day-to-day job? For our participants at Youth Villages, Module 3, Enhancing Attachment, was the most beneficial for them. And some of the other modules, like the trauma module, which I thought we were going to have a big impact on, obviously it's good stuff, it's high quality. Our staff are like, we kind of already know this stuff, you know, and I was like, I felt validated in that. I'm like, okay, well, now we've got the common language and the resources. We are trauma informed. Maybe we're not getting as much out of Module 5 on grief and loss or the trauma module, but Module 3, this is an area that we want to reinforce more of because our staff are struggling with this. The one module they felt like was maybe added the least to their day-to-day job was the Module 1, which was the adoption competency. And this was another one where one of the lessons in particular focuses on, what's the urgent need to move kids to permanency. It wasn't that they didn't like the resource, they didn't find it to be helpful. It's just this was information they felt like that they already knew, and that was good feedback during our pilot experience to bring that back to the implementation team. And I do know that some of the curriculum was adjusted, at least from our pilot site, on the feedback that we shared through that implementation team. So overall, everybody felt like it was very helpful. As we go to this next slide, thank you so much for that. What are we doing now? In terms of the future, since we were a pilot site, we were able to sign a licensing agreement and get access to the curriculum. What we're looking at doing here at Youth Villages is integrating this into our on-the-job training for our foster care counselors, but also the other programs that we work with who come in contact with kids who may be struggling with well-being and permanency. You think about intensive in-home services under FFPSA, obviously we're going to want some intervention for these families. And for kids who are placed in adoptive families, they could potentially be candidates of care. So for me, we're building this in such a way that it's immediately available for those in our treatment foster care program, but it's also available in our other program staff programs, such as Intercept, also our residential counselors. We did have a small group of those counselors. I think we had like 26 go through the mental health curriculum. And how do we apply what we learn with the kids and families that we work with? I think for me, the child welfare version was a lot more helpful for my staff development because of that common language, because of the resources that were available, because of the supervisor support. When you get into the mental health curriculum, obviously some excellent modules in there as well, but some of the EVPs that are in there, we're just not able to implement in our agency. And so that's why I felt like the child welfare version might be a little bit more helpful. What we're going to continue to do here at Youth Villages is we have a licensed consultant who review the treatment plans for our kids, and we do periodic boosters. So we're building these modules into our learning center. We're connecting them to our on-the-job training. And then as needed, if we've got a team or a region that's struggling with a particular area, we're going to be able to utilize this training for that common language with resources available. And the consultants should be the ones who are reinforcing that. I think that's probably about it. Edna, is that the end of my slides there? Okay. So I might have gone through that a little bit quicker than I was planning to, guys. Sorry about that. I was a little excited.
It's okay. That's perfectly fine. Hopefully, there will be lots of questions at the end. So thank you so much.
Yeah, thank you, Michael. That's great. And Michael's going to stick around. Like Edna said, we'll have time for questions. We just have a few more slides to talk about NTI and in general, and then we'll open it up for questions. So please hold those questions for Michael or type them in the chat box now, and we'll make sure to get to those. So now that you've heard from Michael and his experience in the pilot site, really the question that you all need to answer for yourself is, how does this benefit your organization? And how can you use this training to help better equip your staff to support children, youth, and families? We think there's a lot of benefits to NTI, and as you heard Michael say, this aligned curriculum really leads to better collaboration. It opens discussion among staff and gives them a new shared language. We've also heard that participants are better understanding the depth of the needs of those in adoption, guardianship, and kinship situation. It really helps build casework practice to improve outcomes. And so that child welfare curriculum is really more focused on this casework practice, and the mental health professionals curriculum is focusing on that clinical practice. So NTI can be used not just to benefit that casework practice, but also to improve those clinical assessment skills and therapeutic strategies. Participants have said that they use these skills that they learned from NTI in their everyday work, and we've heard of very specific tools that they have pulled out from the curriculum that they use with clients. Also, NTI really develops that clinical practice, and it gives people that maybe are in private practice, therapists, it gives them an adoption competency niche that can really help fill the needs and the gaps in your community. So this is, it's a great curriculum and easy to access, but really what we think is important to highlight is that there are a lot of tools that you need to put in place to help with that successful launch. And so it's really most successful through thoughtful implementation. And I'm glad that Michael mentioned several times the work of his implementation team. And that's really critical, is to have an implementation team on the ground that's there helping to launch NTI. So we have created an implementation guide that helps agencies think through the important steps to the process, from really those early planning stages through completion of the training. So if you would like to see that guide, it's available again on our website under implementation resources. In addition to that guide, there is also a transfer learning guide, which Michael mentioned as well, that critical piece of helping your staff transfer what you learned in the training into actual practice. And so we've developed a guide that can assist with that. And then also, as a part of that, the transfer learning piece as well, We have tip sheets that go along with each module. So these are just one-page tip sheets that give you some really good highlights and activities for, again, using that content in practice. So all those tools are available for free on our website. They're all downloadable. We also have a lot of other things on our website that can help you to promote NTI with your team. So once you're planning that implementation, you know that you want to use NTI. We have some videos that you can use and send out that talk more about the benefits of NTI, where you hear back from agencies and practitioners that have used it. We have brochures, testimonial messages. We have our logos, and we also have, just a variety of communication tools that you can actually use and send out to your staff and share. So again, these are all free and available to anyone. And for your access options, we have 3 ways that you'll be able to access NTI. As Michael mentioned, his organization has signed a cooperative agreement with us, a terms of use agreement with the Center for Adoption Support and Education. We're actually able, free of charge, just to give his agency the files that they can then put directly into the learning management system, and their staff can access it that way. It's also able to be accessed through the Center for Adoption Support and Education's learning management system. We have one here. And if you're interested in that option, you can definitely reach out to us at our contact information at the end of the webinar. And then the third option is that the Children's Bureau, who funded this project, also has a learning management system that's available to the public, and it will be accessible on that learning management system as well in the coming months. So please do reach out to us, though, if you are not on our mailing list, or if you would like to get the files directly from us, reach out to us and we'll start communicating with you about how to do that.
Thanks so much, Emily, for all of that background information. And as you can see, we have lots of tools and resources to help you with implementation and transfer of learning. One thing I'd like to mention is that Emily and I and another implementation specialist, Lisa Maynard, are all assigned to different states and territories. We provide support around promoting NTI, integration, implementation. So we're here to work with you. I saw that there were people on the webinar from Louisiana and Indiana. So I'm going to give you a shout out since you're 2 of my states today. But in addition to providing implementation support, there are also additional services that you can contract with CASE or with NTI to really further or expand addressing your needs with NTI. These include things like implementation consultations that really go in a lot more depth, staff coaching, for example, and then there's a train the trainer, sort of training and support for supervisors to really help them with integration and applying the tools and the skills of NTI. And if your organization is interested in that, feel free to contact me. My email address here is on the page. Further, I wanted to reiterate that you will be getting copies of these slides, which will have all of the resources and background information. So feel free to follow up with us regarding additional support services. Next slide. This is the second in a series of webinars. We have 3 more scheduled for March, April, and May. In March, we're going to take it to the street. We're going to be incorporating transfer of learning. So a lot more discussion around application and transfer of learning. In April, we'll be talking about coaching and supervision for child welfare. And then in May, we'll really be focusing on mental health professionals. As you know, there are 3 trainings, the one for the mental health professionals, one for child welfare professionals, and then for mental health or child welfare supervisors, those are the additional modules that really are designed for supervisors. So with that, we want to sort of transfer to you, so to speak, to see what questions you have about implementing NTI in your state or your agency. Feel free to share any questions you have in the chat box with us, and we will be glad to respond. I didn't know if you had any. Is there a cost? The training was designed to be free in terms of access, of course. As Emily mentioned, there are 3 different ways to access the training, of course. It was designed to be free to users. In some cases, if you're getting CEUs, for example, through Cassidy's seminars, if it's not necessarily for a social worker, but for other disciplines, you would have to pay $40 through Cassidy's seminars. The training, once you complete the training, you get a certificate of completion. Then you access Cassidy's seminars, submit your certificate of completion, and then get your CEUs. But this training was intended to be free in terms of access.
We had another question for Michael. Michael, how long really should people plan to be in that implementation planning phase? So how long prior to actually having staff take the training do you need to start as an organization planning for that?
It's definitely going to take a couple or 3 months on the short end, if not a little bit longer. When you think about bringing it in and integrating it into your agency, you want to be mindful of what you're doing now and how this will be worked into it. I mean, the value added is in the moment they do the modules, they learn something, they have a aha moment, they go apply it with a youth or family, but there's so much information in these modules. You really want to commit in your implementation planning to a period of time that allows them to go through the curriculum that is an appropriate pace and that reinforces the transfer of learning. So, for us, it was we wanted teams all progressing through Module 3, all through 4, all through 5 together. So some would go a little bit faster. The ones that were behind, we try to get them caught up to the same point so that they're using that common language. People are more likely to retain what they find that they've used and it's valuable to them. And then once you get to the end of the training, it's like, oh, that's done, I get my CEUs. No, I mean, you want to continue that transfer of learning. So how do you go back to the resources? How do you apply that with this case? Oh, and you know what? I've got this other case that this may be helpful with. How do I apply it with that case? And so 2 to 3 months to prepare, 3 to 4 months to do the training, 2 to 3 months on the back end to facilitate the transfer of learning. I mean, that's for your initial launch. And then to maintain after that, just making sure you've got a continuous quality improvement process, a CQI process, to ensure that you onboard your staff, they have access to the training, they use the training, and it's supported. Because you will start to get staff with different levels of exposure to the training. The new hire who comes in, there's nothing about it versus someone who's been doing it for a couple of years now. Just something to consider.
And that's another thing that you mentioned is that the training, even months after you've formally completed it, is still accessible for you to go back and review. Yes. So that's something important for supervisors and staff to think about as they move forward post-completion.
Yeah, and I mean, that's what really stood out for me is that one specialist or a foster care counselor in particular, really connected with that video. It made an impact on them, and they didn't even think about it again until a couple months later, a kid was struggling with an issue, and they, oh, that reminds me of that video. And they had the source. They had the resource to go dig that video out, watch it with that kid and that pre-adopted parent, and it was impactful. It made a difference to them. And so that's an example of that transfer of learning. Is we're planting a lot of good seeds with this training. High quality. There's so much data, but you need that longer process for that transfer of learning, just so that they've got time to go out and apply it.
One question that comes up when we go to national conferences and regional meetings, the question is, can foster or adoptive parents take NTI? The training is designed specifically for mental health and child welfare providers. And of course, some of those by chance are adoptive or foster parents. However, it is intended for professionals. What we've found is that a lot of the activities and the resources can be used with parents. So hopefully we might have the opportunity to develop something for parents in the future.
Yeah, and that's a really good question, whoever asked that. And it's something I've thought about often is we frequently have to have training for our professional foster parents. We call them treatment parents at youth villages. And with that in-service training, you know, would it be helpful for them to view a module and to go through that process? So it's a delicate balance that we call them professional foster parents, but they haven't been to school for this. If there was an adaptation for foster parents or pre-adoptive parents, I think that would be great. I'd definitely be interested in it.
That's definitely something we hope for in the future as well. And Michael, one last question for you. Do you recommend that your administrators and supervisors take this first?
Yeah, so it's always helpful for your leadership to have a little bit of a lead so that they can answer questions. The way that our pilot initially rolled out, we did try to give supervisors a 1-week lead time, but over the course of the weeks, obviously things happened and it became a struggle if a supervisor was a little bit behind their team. So as much as possible, you want to have a senior leader who's completely bought into this and is a champion. And you want to have supervisors who are invested in this and committed to getting through the process so that they can help the child welfare professionals on the front line to get through the training themselves. It's helpful to have the handbook. The training that goes along with it just reinforces really specific tools on how you can use this with your team this week on this resource. So, I mean, I found it to be helpful for the supervisors.
Well, and for any agency administrators on this webinar, that's just important to note. If you do want access ahead of your staff, that's absolutely something that we can do and enroll you in the training before you formally bring it to your agency. So please do consider that so that you can view it and see the value of it for your staff as well.
Yes.
Well, we want to thank you so much for your time. Thank you, Michael, for sharing your experiences. We do have Michael's contact information on the slides as well. You will be receiving a link that has a recording of this webinar, and here you'll see contact information for us here at NTI as well as Michael. We hope that this webinar has piqued your interest in implementing NTI. I know some of you are actually in the process of planning for implementation and launch. Feel free to contact us if you have questions or have any specific needs. We're really thrilled with the outcomes of our pilot for this training, both for child welfare and mental health. And we are truly looking forward to assisting you as you launch NTI. Thanks so much for joining us and have a wonderful afternoon.
Thanks, everyone.
Thank you so much. Have a good day.